Okay, thank you for that.
And Supervisor Norvell's not gonna make it today.
Okay, well, he's not,
FYI.
yeah, so she's excused, and you said Martin was excused?
Yes.
Okay, so right now, we're, alrighty, so can we call a roll call, please?
Anthony,
Here.
Joe,
Yes?
Mark,
Here.
Perry, Tim,
Here.
Gina,
Here.
and I'm here.
You sure? Alrighty, so the next thing would be to approve the agenda. Does anybody have anything to add or have any questions?
I make a motion to approve the agenda.
I'll second.
Okay. All in favor, can we do this by hand since we're so many of us? And everybody? Okay. Alrighty. Public comments. Is there anybody here in the room that needs to say anything or would like to, or anybody here at the table?
Turn it on,
Yeah,
right?
I don't think the
Yes, please.
microphone's on. You got the mic on?
Yeah,
is it? Okay.
I think I'm on.
No.
Victoria Kelly, Redwood Community Services. We're not on the agenda today, so I just wanted to make sure I handed out our data for, I'm hearing things, right? Okay. I guess that'd be, our data for the last month, with also, I've attached some success stories that, were provided to me by our crisis and our adults in TAY program, and I really encourage you to take a look. They're pretty, these particularly, I think, are speak volumes regarding our services and supports and successes. And I did just want to highlight, and unfortunately it's today, the training, but we do have a really, there are 2 other opportunities in the region, but in Lake and Humboldt counties coming up. But we have partnered with a program. Why I want to highlight this is it can come, and we are hoping to bring it back and also build a facilitator here locally for this. So it's a partnership with Open Doors, and Open Doors is a part of Catalyst Center, a statewide training platform, specifically focused on serving children and youth in behavioral health and foster care and trauma-informed practices, things like that. And Open Doors is is really around a training focused on how to support conversations with youth around substances, and not from a clinical lens, not from clinical language, but really for any person who's interested in having more comfortable conversations with children and youth regarding substance use, from a harm reduction lens and just a caring adult. So we have that training actually going on today here in Ukiah. We have another training in Lake, I think on tomorrow, and then there's one in Humboldt. But we also hope to bring that back and have some, at least one of our youth go through the train the trainer portion at the Arbor, and then be able to have that locally available for request and resource. So I will pass this out, and then I'll leave the rest at the front for anyone else who wants it.
Thank you.
Thank you.
Hi, I'm Sarah Walsh with Anchor Health Management. I don't have a handout this time, but I do have an update on our MHRC. So we did have DHCS do the walkthrough. It went really well. It was a real positive experience. And so this point, we just need to hire people, get them fingerprinted for the final, so that we have the minimum number of staffing according to DHCS, and then we can go. So that's kind of where we're at with that. Do we have any other questions? Yeah, exciting.
Congratulations on that.
Yeah, it's been a process.
It's been a process.
Hello, everybody. Brian Erickson with Tapestry Family Services. And I wanted to highlight through the first half of the year, since we've finished half of the fiscal year, through the months of July through December, we had a total of 535 referrals for mental health services, or especially mental health services through Medi-Cal. 535 is quite a big number. It's actually the total number of members of Congress, both the House and the Senate. Also, the Library of Congress has 535 miles of books. I thought that was a really interesting exact number. And we've continued that trend in January. We've seen that pretty much every January. So far, as of yesterday morning, we had 71 referrals in the month of January. 29 of those within the last 7 days. So it is picking up pretty intensively. It is that time of year that we see that happening normally, though. And also for the first half of the year, July to December, we had 15,814 total services that we provided, which that's almost the population of Ukiah. So it's like right there in alignment with it. So we've done a lot of work. And very excitingly, as a matter of fact, I think just about right now, we have a couple of our staff who are in Point Arena who have some scheduled appointments with community members to introduce our organization, introduce the services we provide, and begin coordination of our staff going out to provide services on the South Coast. So a lot of exciting things going on. Yes, John?
Of those numbers of people served, how many are on the coast and how many are in the, do you know that?
Off the top of my head, don't quote me on the number, but I believe we have something like 206 active clients on the coast. And we have served over 300 within the past year. So since we opened our office in Fort Bragg in November of 24, we've served over 300, and I think there's more than 200 active.
And then did you get your van?
We do have a van. It is currently being worked on. Very excitingly, all of the sound deadening has been put in, as well as the separation wall in between. I think is what they're working on this week. And we're on track to get it back, I think in the middle of March is when we'll finally have it in operation, and we'll be able to take it out to have the mobile unit. So very exciting. Can't wait to see it. Can't wait to drive it. It's gonna be a whole lot of fun. Anything else?
So what days are you able to provide service to somewhere like Point Rita?
That's what they're out there working on right now as we speak.
Okay.
Is coordinating. I think they're meeting with the schools, as well as a couple of community members who have asked for us to come out and talk about the services that we provide, and depending on how many referrals we get, what the volume of services that are needed, we can basically adjust to try and meet that need. All right. Thank you very much.
Thank you.
Thank you. Anybody else? Just visiting? Alrighty. Okay, so let's go forward from there. Need to approve the minutes from December first meeting. Did anybody find anything in them that they felt needed to be, taken care of? Were there any changes? Do I hear a motion to accept?
I'll make a motion. I'll second.
Alrighty, so, I guess we'll do it by hands again, does that make it easier on you? Okay. So, all in favor?
We all agree?
Yeah. I'm pretty agreeable to me. So, it has been approved to pass the agenda, pass the minutes from last month. So rolling right along. This is the month that we get an update from Dr. Miller.
All right, so the director report is in there if you guys have any questions. Always note or anything else you guys want to see, we can go ahead and add to that. The pup is coming along, which is good news. There was one blip, but then it turned out to be fine, so that was good news.
Did the switchgear come in?
I don't know.
Okay.
I think it did, but I'm not positive. But hopefully we're still on track for the same opening date. We've been having some meetings with Adventist Hospital and ResPAD. So we had a meeting with Adventist Hospital and ResPAD last week, and then we also had a meeting with ResPAD and the transfer center that Adventist Hospital utilizes to start building those relationships. And both of those meetings went very well, so that was good news. And we continue to build those relationships. We will get ResPAD here to make sure that when they get some time, you guys want them on the agenda, we'll get them here hopefully before they open, so you guys can get introduced to them, and they can talk a little bit about their processes and their models and what that will look like for operating the facility. So that's kind of an update there. Pictures of the pup in the back if you wanted to see them. We try to get you guys updated pictures on a regular basis. And we're still looking at March, April, last I knew. But with construction, it's an ever-changing moment. So fingers crossed. Then in regards to just some things that are happening, as we know, the governor released his budget. There was a big presentation on January 9th. I think the big things that we're watching from that budget is from on one side, from the public health side, a lot of the systems we utilize to track a variety of things. So a lot of the technology systems are not planned to be funded this next year. So some of those systems, which is my CalVax, CalConnect, CalReady, CAR, if the state decides not to fund them, I'm not sure that the counties will have the funding to fund those, so we could lose a lot of that. Those databases are a lot of how we talk between providers, and how we talk to the state, and how we can track what immunizations you got, what vaccines you have, how we track diseases, and disease outbreaks. So there's definitely some concerns there if we lose some of those systems. So we'll continue to look at see how that unfolds, and the association is definitely pushing back, saying we need to make sure we're able to continue to fund our public health systems the way that we've had funded them, especially since we've been through COVID. I think we learned a lot about needing those systems. On the behavioral health side, there is a projection to take about $150 million of Prop 1 funds in lieu of state general funds for workforce and prevention programs at HCI and CDPH. So it's an interesting thing that they want to take BHSA, Prop 1 funds, and substitute them for state general funds, which was probably not what we all thought when we voted for Prop 1. The second big thing is the governor is because of the federal match for Medi-Cal billing. because it will go from an 85% match to a 50% match. And it's something we're gonna have to watch for all of our programs, but this one is definitely right up there right now for mobile crisis services. There is a projection that it will go from a mandated service to an optional service in counties. So the state had pushed that all counties had to implement mobile crisis as a mandate. And now they're saying by April 1st, 2027, there's a good chance that we will now see that as an optional service versus a mandate because of the federal match dollar, that the state is not going to be able to put up that 35% match that's being lost, and the counties would have to subsidize that themselves if they want to continue to fund that mobile crisis services. So more to come as we continue. There's some that our association on the behavioral side is also pushing to see what we can do to see if we can keep those services funded, but it probably will mean we have to relook at how we do crisis services in Mendocino County. Some other updates, environmental health has come back to health services, so we now have back in health services, emergency, EMS, emergency medical services, that came back in October, and now we have environmental health also back as of January 1st attached to health services. So just some changes there. We applied for a COPN grant on our substance use sites and were awarded that. So we're glad to be able to continue to work on that. It really works at overdose prevention activities, and so that's what we'll focus on with the COPN grant. We, Mo and I talked about, we applied for the Community Cleanup and Employment Pathways grant, and we got asked by them whether or not we could expand what we wanted to do if they gave us some additional funding. And so what we had originally had proposed was Ackerman Creek and Talmadge Bridge area. We came back and proposed 3 additional areas for that grant, which is Dolan Creek, Airport Road, and Highway 101 around Ore Creek and stuff. And so we'll see, but it sounds very promising that they are looking at funding that project for us, and wanted to see us expand that outreach into different areas within the county.
Is that gonna eventually go onto the coast and?
I don't know, it's a one-time funding. If they expand it, maybe it's really to focus on homeless and homeless cleanup
Well,
and your creek beds.
that's
Yeah.
why I brought it up.
I don't know.
We have a few.
I don't know. I know this is what we propose now. We'll see if they continue to offer more funding and if we can expand it more.
I think I would just say that my 2 favorite words, pilot project, would be used, and it'd be an opportunity to create some measurable outcomes to be able to get more funding for other areas in the county. So that's
Okay,
my goal.
So that's what this, to you, this is a pilot. That makes sense.
If we go back to the cut and changing the mobile response or treatment centers, if they make it so it is no longer mandatory, but just discretionary is with the area, does it seem likely that they'll make it so the costs, because it becomes discretionary, will completely fall upon the county?
Yes. 35% of the cost will fall on the county.
Then
Right, unless we can come up with a different way of utilizing like BHSA, but of course our BHSA is limited also, right? So the counties would then have to make up 35% of the cost.
okay.
So I think strategically we'll have to look at merging our crisis and whether or not we need the 2 crisis models we have now to be able to suffice. So some things we're looking at, what does that look like if this goes through? How does that change?
And then we have till 2027, basically.
April 1st, 2027.
Okay.
Yeah. And so I'm sure we'll, as we see what the May revise brings out and what we're able to negotiate, that could change. But I would assume probably, by July, August, we would be looking at implementing what changes we're going, so we have it in place by April.
Sounds very smart, actually. Thank you.
Yeah. So we're doing our community health improvement projects in throughout. It is a public health project where we work to see what for the next 3 to 5 years what we're going to work on for community health improvement projects. We've been working with Adventist Health. We did a community health needs assessment and co-work on community health improvement projects. And I mention it here because we definitely, 2 of the areas that we're working on is behavioral health and substance use, and then access to care. And so those are two of our projects we're working on. We're also agreed to work on diabetes because we really heard from our tribal communities about the need to make that a priority in Mendocino County. So we are working on that also. There's a couple other ones, but for this, the big thing is that we are working on mental health substance use and access to care. As a whole, access to care is not specifically just mental health substance use, but access to care in general. We have 2 fentanyl events coming up. We worked with MCOE, had wanted to partner on doing some fentanyl opioid events, one on the coast and one in Ukiah. And the coast date I think is set for 2/11 unless that changes, and then Ukiah is set for 2/18. And the plan is to rent the movie theaters and be able to go show the Fentanyl High video for, and this is really a focus on parents in the high school, junior high, elementary, with a second theater being rented out for a movie that Kids Book can come with kind of daycare providers so that the parents can attend. And it's a real focus on educating parents on fentanyl and opioid in Mendocino County. So we've been working on awareness and education campaigns, a lot on Kratom, which I know there's a movement from the state to try to make it illegal. That has it, to really ban Kratom. It's a leaf that, it's a herbal supplement that has been around for a long time, but it's a leaf and it actually creates a very strong addiction. And you see it in lots of drinks. And it's become kind of a big push. A lot of people are selling it now, and like different. You'll see Kratom drinks and Kratom and everything.
I've never seen that installed in Tennessee last week, and they had cafes with it.
Yeah, it's getting.
In Tennessee?
It takes the withdrawals out of opiates, sweeping off opiates.
Yeah, that's what they use to say.
So that's what,
It acts as an opiate in the body. You
but
can
that's
be
what they do,
addicted to
they
it.
take something that has a good outcome and it gets, they
Becomes
find
an
it.
addiction.
Yeah.
Yeah.
Have you worked with Dr. Young's office at all here, with the pain management group, with strategies for mitigating opioid addiction?
I don't know if we've worked on it from that angle, but we could connect with him and see what he's interested in.
I think it would be a good source for.
We could definitely do that. So yeah, Kratom's a big thing on this up and coming. It is in Mendocino County. And so if you go to different gas stations, you can actually find a lot of times it's in drinks. It'll say Kratom. And it's very addictive. And it's unfortunate. But it's become, and California is looking at, whether they could, what a ban would look like, at least from the public health side of things. We're looking as we do the Whippet ban, we're also looking at would we add the Kratom into that if the state isn't moving quickly or moving forward with that. But there's some legislation moving on Kratom specifically. We also are doing a lot of education and awareness on mushrooms. This, for some reason, they have a lot of people are picking mushrooms right now. It's a very good season. We have more mushrooms blooming and growing than normally.
Oh, yeah.
Unfortunately, people are foraging and not realizing what they're eating. So a lot of people are picking the death cap mushroom, thinking it's one of the good mushrooms.
Because it looks so pretty.
Well, it looks like, it looks identical. If you actually look, I mean, if you don't know what you're looking, you could totally get confused, right? And so there's been a lot of it. We've had in California 3 deaths from mushrooms and 3 liver transplants and several people who've gotten sick. So there's a lot of push to educate people, don't forage mushrooms, and trying to reduce people foraging mushrooms. I guess it's a really big mushroom year. And obviously working on all of our overdose and suicide prevention awareness and education campaigns. And we try to really work on what is the big thing for the month on doing education and awareness. So both on the public health and behavioral health side, we're doing a real push on what's the big things those months. CalAIMS, we're rolling CalAIMS out this year with the plan to be rolled out. We were hoping to be rolled out earlier, but they have to be rolled out by October. And so we have been working with Juvenile Hall and the jail to get them ready and ready to bill Medi-Cal in the jail for services. We will be working with them on doing their billing for the juvenile hall and jail. We rolled out Avatar into the juvenile hall, and we're working on having NAPCare system connect with Avatar to do all of the billing and make sure all the documentation's in place. And so we're taking on all of that task, but we've been building out that program with the juvenile hall and the jail for them to start billing
So
their services.
the jail, once it's complete, we use the Avatar also.
Well, once
Whatever they.
the jail is, not the new jail, this is a state mandate that, they have to be able to provide, bill Medi-Cal services for, anything you can bill Medi-Cal for medical services, for mental health services, and it's anybody who's 90 days pre-release, you can bill for their services. And so we're looking at, we've been building that within the jail to get NAPCare, who's their provider, up and running. And then working with the county staff and the jail for discharge planning and all providing those services, and then connecting with providers on the outside. This, there is the thought that this is a waivered program, and there's a good chance that it will end at least the 90-day because of the waivers have to be renewed at the federal government level. This is a benefit in a lot of other states, both blue and red states, but it's a 30-day pre-release versus a 90-day pre-release. So we believe in the state of California, it'll probably move from a 90-day pre-release to a 30-day pre-release being able to bill. But we still have to build a program at this point as a 90-day, knowing that we'll probably move it back to a 30-day, depending on how the waiver, what happens with the waiver in California, and how that gets signed. So, yeah.
Are you going to put an enhanced care management component in the CalAIM with the probate? I mean, that would be the natural place to be putting that. Anybody that's leaving a jail or leaving or is on probation should have their medical, their behavioral health, all of that. I mean, I'm listening to the people that are advising you on homelessness, a number of different issues, and substance use is top in that, and that requires someone on ECM.
Yeah, so part of the discharge planning aspect that the county NAPCA will be doing is making sure they get connected to all the services they can, medical, behavioral health, substance use, ECM.
And follow up with that, right?
Right, that's to get them connected, to make sure they get connected and they get appointments. So there's a piece that discharge planning will handle.
Yeah, because you can bill for it, but it
Yeah.
just has to be done.
Not yet, but yeah, once the jail
You will,
gets rolled
yeah.
out, once they're up and running, both the juvenile hall and the jail, we'll be doing that.
Perfect, because that, I think, is going to be critical to whether those are successful or not, especially the juvenile hall.
Yeah, we're in the process of doing our RFP for BHSA, and your member, lovely Joe, has been a part of that RFP review process. She can't speak about it yet, but she has been here a couple days, reviewing.
Going at home too.
And at home, reviewing all the RFPs submitted, and looking at what we will be contracting with for BHSA services for the next fiscal year and moving forward. And so that's been a process that we're in. We are also looking at what RFP we might put out this year for special mental health and or crisis services. So we will be looking at if we are going to issue an RFP this coming year that would we need to get it out and done for a July 1st date to start services.
Where can we see the RFP for that?
For which one?
For the BHSA contracts?
It's online.
It's on the
County website. The county has an RFP bid website. If you go to that, all the RFPs are there.
And the criterion for
Everything is in there.
is in there?
Yes.
If you like some light reading.
That is what we're charged with.
All right. So those are the big updates. The last update is that we wanted to schedule the group photos since everyone didn't want individual photos, but you agreed to a group photo. I know y'all thought I forgot. I did.
She's like a dog with a bone on that one.
But I didn't. But Joe would like us to wait till August, so we're on the coast and we get a nice coastal picture.
Well, there's that. And then by then we will have our empty seats filled. or
Probably.
possible.
Oh, right.
Yes.
That's a good idea.
I don't think we should do it until.
Of course, Stephen, I'm fine, I like it.
I'm trying to push it out.
So how many empty seats are there?
There are three.
There's three.
There's technically three that are vacant.
Which are the three?
Huh?
Which are the three?
There is, District 3, which was, you were
Jeff.
Jeff, and then there is,
I requested to continue on. Have you not talked to John Hastrap about that?
no, we played a little bit of phone tag, so I will call him, because I had to call Madeline for District 1, and, I will talk to him.
Yeah, because I hear a lot of plans, and I had put in for that, and I want to know what this strategy is with making those decisions. If a board of supervisor appoints somebody, then how does that work? I know that this is one of the very few boards that it has some very interesting ways to go about making sure who goes on this board and who doesn't. So how does that work? Because I keep hearing this, so I just want to know on the record in a recording how it works.
It's up to the Board of Supervisor to appoint. If it's an open seat, you don't get appointed by your district's supervisor. It would be Mo. If it's a non-district seat, as the board representative for this board. If it's a district seat, then you get appointed by your district supervisor. And then it would go to the nomination committee there's a committee that would review, I think it's the executive committee that reviews and would meet and determine whether they agree with the appointment, and they would let the board of supervisor know. And then the board would bring that to the full board.
And there's also the designated seats
There's
also.
designated seats,
But I
which
think
is
they're
the.
full.
And who's on the nomination committee?
I have to look at the bylaws. We haven't had to do it in a while, but there is a group.
Yeah, I'd like to know who it is.
So you can look in your bylaws. And you look at the behavioral health advisory board bylaws, it'll be in there.
And it names the people?
I don't know if it names the people, whether it says the executive committee or whether it says this committee votes for that, so I'll have to go back and look. But in your bylaws, it says how that happens.
Yeah, because I'm going to confer with Sacramento on it, so I'm unclear. I just have been hearing this enough times that I'm very curious as to, I keep hearing about the 3 new appointments and we should all wait until the 3 new appointments happen. And so I feel that there is some bias there, and I would like to know.
I don't think that's
if
what they're
some-
saying, Perry. I think what they're saying is they want to make sure all seats are filled before we do the picture, in the sense of like, Jeff is no longer coming and made it clear he doesn't want to. Both you and Martin have asked to be reappointed. And so I think that that's a different thing. I think we want to make sure that everyone who's going to be on it for the full year, and that doesn't mean you and Martin aren't getting appointed. That simply means we have 3 seats that haven't gone in front of the board of supervisors to be reappointed yet. And I have not heard from John, but I will reach out to John to find out whether he has agreed to appoint you to his seat, because I have not heard that.
Or if he's had other people approach him.
Right, I don't know.
What is it?
He could have had other people approach him for that seat.
I'm well aware.
So it's up, that would be
I'm
up
not
to
worried
him.
about that. Okay.
Yeah, I don't get where you think there would be bias. It's not,
I don't know, Sean.
okay,
It's okay.
because there is no bias.
Thank you.
And I don't understand Sacramento. You said you wanted to talk to Sacramento about it?
There is oversight over this board, yes.
Well, I know.
It is it is state mandated.
No, I know that, but I don't
And
understand.
we have processes, you're talking about, I don't know, you're laughing, is this all?
I'm not
I don't
laughing, I asked you a question.
But anyway, go ahead, what you're doing.
Okay?
All right, so that, we can wait, maybe what we'll do is wait and see, once, the new board members get seated, then, or if they're the same member staying and they're permanent, then we can set the picture at that time. If we wanna wait till August, I think that's fine. I do worry if we wait till August, there'll be some seats that come up again in January, cause every year some seats come up for reappointment. And then we'd be looking to have to retake the picture potentially in January, February again. So, but it is one option, if we wanna wait till August, we can do that.
I just said that, but I think as soon as somebody gets appointed, we can go ahead with it.
Yeah, once all
I
three
just said
seats.
that because I said, well, if we're on the coast, we'll have the ocean behind us.
Yeah.
But I'm just a little biased to the oceans.
So I figure we can get that scheduled as soon as, the three, seats are sworn in and ready to go, and then, we can go from there. But I just wanted to make sure, it's probably not gonna be next meeting, but you all asked that I tell you ahead of time, so that you can dress appropriately.
We'll have it in, if Dobby sends out the invitation and you've decided it's whatever, we'll just have her put it in bold, so everybody knows they don't have to come.
They don't have to come. Well, you don't want us to do AI generation of you guys, that's our next
It might-
option.
No, yeah, you better
It might
drop
look
Yeah.
better than.
I might get younger.
We could do caricatures, there you go.
Oh, that's fun.
Since
Alright,
we're
you
all.
just let us know when.
We will.
Sounds good.
All right.
Okay. So are you pretty much done?
I'm done.
Okay. So, one of the things that came up in our last meeting, and actually it's come up before, is how we want to develop an outreach plan so that we can do our own PR, for instance, so that, and we don't, there's no guarantee how it gets picked up, but we were talking about a quarterly newsletter, we were talking about social media, we were talking about all these things that we have listed here. And has anybody, come up with any ideas? And then the other thing is, if we're gonna do a newsletter, does that come out of your office? Does that mean that puts more burden on your staff?
Probably, yeah.
Well, after working with him as much as I have lately, I don't know that I really wanna dump that on their heads, but it could be worked in. But that was one of the things, so does anybody have any, we left saying that we would discuss it today. And does anybody have any ideas, any of you in the audience that have had things work for you? I know we have a big presence on Facebook, and I'm seeing much more of that. I don't know who that is, but they're doing a good job of getting it out there.
That's Rosanna.
Is that you, Rosanna? Thank you.
Yeah, I've seen a lot on there.
Yeah. Yeah, you've put a lot, it's been varied, it hasn't just been behavioral health pictures, it's been other things.
Mhm.
Is Facebook the only social media platform?
No, we have,
Facebook, Instagram, and Twitter.
Yeah.
Okay.
And I don't do either of those. I just do
Just
Facebook.
make sure it reaches the swath
Do
of
you have
population.
Instagram and Twitter for the store?
Oh, yes, we do, but personally, no, I don't use it just because it's
You don't have to.
interesting. Anyways, I actually wanted to ask, is QR code something very age specific? Like, because whenever we put something out in the stores, a lot of links go with QR codes.
Yeah.
Is that something that would be possible that bridges a little bit more of a generational gap? Or is that something that is my age group and therefore old?
QR codes are not old, no.
No.
Okay.
No, we use it a lot in
QR codes are
education,
So,
in our flyers.
I
What
don't
if we
use
had
it
it
at
so
all. I've never used
we
one.
created a QR code and it would be something that could even be included in what we have as far as the billboards and links with what would be some of the outreaches and services that we have in our area. So it'd be something where, you know, somebody in a moment of need would be able to scan that and be able to start finding resources around us to be able to link to. So it'd be something just a little bit more streamlined for people when they're desperate.
We can
Could
definitely
link
do
to the-
QR codes,
your-
the Good to Know Mendo.
Yeah,
Mhm.
so I was
Yes,
thinking
I-
it could be.
yeah.
It can definitely link to Good to Know Mendo. I was
Yeah.
hoping to show you guys the dashboard today, but when we haven't been able to get it on Good to Know Mendo, it is created, so it's pretty cool. And
There's a
so,
QR code on that?
no, but we can create a QR code. This is data from Mendocino County. It's
Okay.
a dashboard that
Dashboard,
shows all the health outcomes in Mendocino County, and so you can see by disease, overdose, suicide. You can put in the data you want to see, and it'll pull it and match us to state of California versus Mendocino County. So you can see like chronic liver disease, the state is like, I think 4.4, and Mendocino County is like 26.6.
Oh, wow.
So,
Boy.
yeah,
Whoa.
and that one really stood out to me as chronic, is because, you know,
No
we were
kidding.
going through chronic liver disease, and one of the things we've tried to really focus on, and we've been working with the Epi on, is we talk a lot about overdoses or impacts to drugs. We don't talk about the long-term deaths to alcohol,
Yeah.
right? Because it's not usually an overdose like a drug overdose, so
It's a
we
slow
know it's a
approach.
slope, right? And so we know there are a lot of diseases that are connected to chronic alcoholism. And so we've been trying to look at how do you show that, because it's, I know alcohol is very socially accepted, but there are consequences to drinking too much and long-term side effects. And so we've been trying to look at that connection and how do we show that. And, you know, some of that looking at chronic liver disease, right? Like, what is that? Why are we seeing that in Mendo? And what is it related to? But we can definitely see some places we're right at state, some places we're really under the state, and other places like chronic liver disease, there's a discrepancy there, right, between what the state of California and what we're seeing from Mendocino County. So it's definitely will be really nice. That will be on the Good to Know Mendo page, so that the community can access it and get all their information. It's also a page we're looking to put all the resources. Like if you want to know all the clinics in our area, you can find it on Good to Know Mendo. You want to know all the mental health providers, you can find it on Good to Know Mendo. So really trying to create that page and to be a resource link. We've also been trying to put on what are resources for families. If they want to know what are the different, you know, a lot of people say there's nothing for kids to do. We really want families to be able to go and say, here are some resources or activities for kids in this area, and how do you connect to Little League or, you know, football or soccer, or so that families who maybe are struggling to find that can find those resources easier. So that's my big vision of Good to Know Mendo, and it's slowly coming along. But we could do a QR code that could link to that website.
So on a QR code, I know what they are, I've never used one. If one was on a billboard, and presuming you have a phone with a camera, you can take a picture of it, and you would be
Right.
able.
Well, I think your passenger.
Your passenger.
Should be the only one using
Yeah.
QR code.
I don't know about that. That's right.
No driving, no driving slower, no.
There could be somebody walking on the highway too.
Okay, well,
Yeah.
passengers or pedestrians. We're not using.
Don't stand in the middle of the road.
Yeah.
Okay, and don't stop your car in the middle of the
No,
road.
thank you.
No, but the question is, I don't know how they work.
You open your camera. Yeah,
Yeah.
you open your
Go to the
camera, you
website.
put it on the QR code, it
You
usually
just-
pops the thing up, you click it, and then
And
brings
it
you to the
takes
website.
you there.
You
Yes.
touch the little outline of the QR code,
Yes.
it'll create a little square around the QR code, you touch that, and it gives you a
So
link.
it just becomes
takes
a
you-
link
Yes, to
Yeah.
go to.
Takes you straight to wherever it's linked.
wherever it's supposed to.
There-
It would take it to the landing page. if it's
There
not
was
there.
some agencies that were having some issues with QR codes because I guess you can hack them.
It depends what system you use, because if you use a company like this one I'm on right now, QRIO, they are a third party where you scan it, go to their website, and then it sends it to your website instead. But you can just generate your own without a third party company, and then you can't hack it, so it's straight to you.
There are some that were getting hacked, I guess. We heard from some local providers that had heard, and then it can send you to a site you wouldn't want people to be sent to.
There was a hack that they were talking about, I don't remember who it was, but it was a Zoom hack. Oh, it was at Point Arena,
Yeah, it happened.
their city council. I didn't know you could hack into those.
Yeah, they bomb them and then they.
Mhm.
So that's the QR code, and I made it.
I
so-
know that the.
Well, no, now I made it so if you just scan it with your camera, it'll
Yeah.
pop up right here. You click the link, and now it takes you to the county website.
Perfect.
Oh, So you just made that for Good to Know Mendo?
No, not for Good to Know Mendo.
For the county website.
For the county website in general, but it takes 2 seconds, you can
It's
make
very,
one
yeah.
very fast.
Yeah, Dustin does them.
Okay, I'll get there.
If you're on Windows, it's faster, you can literally just right click it and hit create QR code. So, simple.
So there's gotta be a place in the world where all QR codes go so that nobody gets duplicated.
I guess the question around the outreach, just to bring it back to the agenda item, is the goal to share with the information the work that the department's doing, specifically how it relates to this board, and maybe how this board is approving this work. You know, each month you all are seeing the work that's being done, you're seeing the data, and sort of giving your stamp of approval or asking questions about what's not being done and following up about how it needs to be done. So I think the idea, Joe, maybe is to share with the public the work that's
Right,
happening.
that's where we're going, and so that's where the QR code, and we did go off into left field a little bit. But, and that was my fault, because I didn't.
I'm reeling it back in, so.
I know,
Let's.
and you're very good at that. But that was the whole point of this subject, was how to get it out there. Because I'm still dealing on it, you know, a weekly basis with people that goes, oh, Measure B, you know, where are those money? Why don't we take that money and use it for, you know, landscaping the front yard? Because nobody's using that money, and they don't, people, but the thing, even when it gets out there, people aren't seeing it. So where do we put this? Or do we put it just in more places? Because the standard way of doing it is no longer working. Obviously, we're talking QR codes. You know, do we start doing it in different ways?
The website we're sending people to, does it have a newsletter form so people can sign up and get monthly newsletters?
Good to know Mendo?
Yeah.
Not at currently.
We don't have a newsletter yet, but maybe that would be the place to put it.
Just have them sign up with their email, and then every month, once we approve it, we send it blast to them in.
Right, and then the other place we could put it is on, if they'd let us, on the county, on our pages on the county website. You know, monthly, you know, quarterly newsletter, if you're interested, you know, opt in.
Well,
If they
the
would-
county is gonna be, I think, updating their website, and then, they actually, I think, want us to shrink a little bit, which is kind of why we moved to Good to Know Mendo partly. And then anything we do has to be ADA compliant on the county website, so we have to make sure that it's specific colors, specific fonts, everything's spelled out.
Oh, God, okay.
And then ADA online. I did not know those ADA guidelines for websites.
Yeah.
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 I had no
It's
idea.
Like if,
extensive.
yeah, like if you have something that's speaking, or you have thinking, you have to be able to have it speak. So if you have like a picture, you also have to be able to have the picture speak in case someone is blind, they need to, or vision impaired, they need to be able to hear what that picture is. And yeah, there's a couple of different.
So,
I'm sure if the schools have it too.
Yeah, all education
Yeah.
websites have to be ADA compliant.
Now
Don't
is-
ask me how they make it do it, but it's a requirement.
Yeah, there's specific colors that they recommend and fonts and all that.
that's interesting, 'cause having had a website for my business, I mean, I knew, the business had to be ADA compliant, or at least said what is and what isn't. And, but I would have never thought the website, and then I do my grocery shopping on a website, and it doesn't talk to me.
So, there's applications that people will have on their computer that allows the, so, but if you're using something that does not work with that app that allows it to be able to speak to it, then, so ours, for business websites, and this is something that we had to cover, I think it was a couple of years ago, actually, and so to make sure that, and I knew you were looking at me when you said it, so, whether or
Well,
not,
it's like, that's a big deal to make a
Mhm.
website ADA compliant.
yes.
It's a lot of work.
Well, yeah, and I'm sure somebody's making money on different applications because of it. You know,
Yeah, pretty much, yes.
so, I mean, I don't want anybody not to be able to use one, but
I think any website that, any entity that receives public funds, it's a requirement. Whether, you know,
So-
private entities, I
So
don't know.
then the website that the county's gonna be working on that our Good to Know Mendo is gonna be, if it isn't already.
It isn't, we're working on it, yes. The county-specific government website has to be ADA compliant, and we are looking at Good to Know Mendo to make it as ADA compliant, because you don't want to say you have a resource that not everyone can use.
Right.
Absolutely.
I mean, we really want a resource that everyone can use regardless. And so it is really, there's some really set stuff out there about what fonts to use, how big the font should be. There's really color palettes that they recommend specific to ADA. And you know, whether you use black or white text because, based on the color and what's harder to see. And so there's a whole guideline for, websites and being ADA compliant, and then making sure that you have that speaking ability. If you're gonna put in a chart or something, you need to have it be able to read it, to the person if they are, you know, visually impaired.
So, it goes back to, what do we want to do to have the perception that we're not doing anything to be changed? That's what I see. And so, I mean, even if you put out a press release, I know you advertise that we're having a meeting, you know, we have tons of people in here. And even when we did our BHAV 101, we got a lot of people, but not as many as I was hoping for. But,
What I think you have to remember, like, if, you know, a lot of what we do, if people see our social media, we always do everything in English and Spanish, right?
Right.
So if you're gonna do a newsletter, you have to think about that too, right? It needs to be in both, at least both language, and Spanish is our threshold language. That doesn't mean we don't have other languages that maybe should be considered, but it's the state required threshold language. So if you really wanna hit your community, then you also have to remember that, right? It's not just a newsletter in English, it's a newsletter in English and Spanish. And then, you know, what does that look like? And then you don't wanna do too small of a font, because those that are visually impaired for a newsletter can't read it, right? And so as you guys look at your marketing, what does your marketing look like?
so does anybody have any input on this, other than QR codes?
QR code in the newsletter. That's awesome.
What would you like to see in the newsletter?
Just basically a breakdown of what was approved, what's coming up on next month's agenda, and let them know.
I think also budgetary. I think that'd be really important for people to know, because the reason that people are wondering is where's the money going?
Mhm.
And so they know what we're spending it on. I'm just wondering if there's if we did a meeting that piggybacked with another meeting, so that people who might not be as inclined to go to yet another meeting to find out what's going on, instead we'd be able to meet, you know, once or twice a year with something that's a larger meeting that occurs, and that way more people would be able to pull together and say, well, I was curious about this, and now it's already attached with that, we would be able to have it.
Right now, quarterly, we meet on the same day with Measure B.
Mhm.
But you
Yeah.
don't meet with Measure B.
No, we would have to put them that would make sense, is to have one meeting where the two boards sit together and discuss.
Yeah.
Maybe once the hospitals are,
Or even before, I think there's been conversations about having one meeting a year with the two entities meet and get to know what each other does, right?
Yeah,
And what does that look like? I think the other thing, if you do the newsletter, I would wanna do it monthly.
Mhm.
no,
But you could look at, kind of off of what Tim said, of like, how do you do a beneficial newsletter? You could, Measure B's talked about how to get more information out in their, out about what's happening with Measure B. So maybe it's, you have your Measure B appointed person who could bring forward, hey, BHAV's looking at trying to do a newsletter. What if we did a co-newsletter quarterly with Measure B?
That
so
would
that
make
that could get
sense.
some updates, right? So then you might be getting it. The other option is, a third way option is, now that there's a public health advisory board, you could see if public health advisory board also wants a small corner in a newsletter, so then quarterly you've got 3 boards that are putting out what they've been focusing on. And then it's not, and then it's actually a joint effort.
Yeah, not each entity
Right.
having to carry their own bucket, but,
Correct.
yeah.
Right, well, we could share, it could share the
Burden.
workload as well as the finances on that too.
Mhm, that would be,
I mean, it all comes out of your office, but it might, you could just call it Dr. Miller's quarter.
Dr. Miller's corner.
totally fair. No ownership or guilt on that one.
So Measure B doesn't have their own newsletter currently? They don't
No,
have
but
anything
they-
for that? Measure B doesn't?
No, they
Oh,
don't
okay.
have anything. They have talked about, there's been a lot of conversation about, how to get more media out there. Because what Joe talked about was a Measure B item of like, what's happening, there's nothing happening, and then, people say, well, we're building the FUF, and there's people who don't know about the FUF.
And they don't know about the training
They don't
center
know
or
about the training center or the
CRT.
CRT or what.
And
is
then
funded.
that leads to the questions like, where's all the money going?
Correct.
Yeah,
Oh, no,
and
yeah,
who's
yeah.
using it?
Exactly.
And right now, with all the other things that are going on within the county, they're thinking it's getting misappropriated. And in fact, at the last Measure B meeting, one of the people on Measure B did not understand. So when we built the regional training center, the sheriff's department wanted someplace for a substation. So it got together, and 2/3 was paid by Measure B, and you guys know this, and 1/3 was paid by the sheriff's department.
So that it could be a multi-use.
Right, so the old minister's house is now a substation, and the old church became the training center.
Mm-hmm.
And it has everything in it for the sheriffs to use as a training center as well. And it was paid for that way. So we have this person sitting on the Measure B board saying, you have $100,000 here, I'm just using that as a, if this costs $300,000 and you've got it in your budget that you paid $200, who misappropriated the other $100,000?
So
And
one of
so
the
we
board
had to-
members wasn't even necessarily
Correct.
privy to
And
that.
so it had to be
They were new.
explained.
They
were
were
new.
new, so they just had questions on
Yeah.
how it all
But-
got divided up.
But that's the thing, it would have been explained. Harry?
I think it's important, if you're going to report and have communications with the community, it's not just important to know where the money is going. The important part of that and what the community is interested in is how effective it is and what's happening. What are the results from your money? What is your money getting you? And that is what we need to convey. And if those answers are tough answers, then we need to solve those issues. But that is what the community is interested in.
Well, what I'm hearing is, where did the money go? They haven't even asked, what's it doing for me, or have you spent it, and is it effective? The perception that I get is that it hasn't been used and it's sitting there and somebody took it.
That might be some people's questions, but
I would
know
almost,
that there are a lot of people who are wondering
that's gonna be the
how
second question
effective
after it.
Right.
it is.
Yeah,
Where did the money go, and now,
And how is
what
it
did it do?
used?
Yeah.
right.
It's valid.
So Joe, as this board rep to Measure B, is this something that you would wanna take back to them? Did the meeting is, the January meeting hasn't happened, or it are?
No, it's,
They meet quarterly.
meet
Oh, they
quarterly.
meet quarterly, okay.
Yeah,
So
so
this-
theoretically, I
right.
can bring,
So that could be a next step, is to bring that idea to
Correct.
them.
and to bring to them maybe a joint meeting, and even at
Yeah.
that joint meeting, have this discussion,
Yeah.
because this is a big discussion.
There was a hand raised back here
Yeah.
too.
I just raised my hand and honestly it was kind of addressed. I think I've been to a lot of meetings over my career, and I think what you used as an example with the 2/3, 1/3 financing, I think so much of the community needs a translator.
Mm.
You know, what you were saying is like, how does this affect me? Like, I was thinking of the crisis funding that may be changing and those I'm on the board of directors of NAMI Mendocino, and so I work with families, I see peers, and they find out when they're in a crisis, or they find out when it's too late, if you will, to understand what's available. And so how do you get a translator into your newsletter that's able to communicate to the community in a way that also doesn't, I don't know what the word is, but
Well,
prejudice
the stigma that
the
goes with even
decision.
looking at it makes
Pardon
it
me?
hard. The stigma of even looking that up is even hard.
It's
Most-
hard.
And most people don't go and look until it's in their face.
Yeah, no, yesterday I was speaking to someone downtown and they had no idea there was a puff unit being built. They had no idea. So I told them where it was and what it was and
Oh, that's what that is.
and they were just like shocked. And these are
Yeah.
people who actually,
Work in the field in some capacity?
no, they don't work in the field, but they have family, they have people they know who would need to
Mhm.
know that. So, and pretty much, I would say, because of statistics, et cetera, almost anyone you're gonna talk to is gonna have someone,
Or know
You know,
someone, yeah.
know someone that needs to know, so we need to know. And so the newsletter, I mean, I have to translate, I come in here, I haven't been here in a long time, I'm like, what does that mean? What's the acronym? What's this? What's that? What is it? You know, I'm like running to catch up. And I've been around this for a while.
The
So-
acronyms are enough to make your
Right,
head spin.
so I'm thinking, you know, if there's any way that you can share it in a way that's, I guess, neutral and not saying, well, what do we think about the sheriff's department spending 1/3 of the, you know, it's not about the decision, but it is about if they wanna know how the decision was made or they disagree with the decision, they can drill in and they can go further. But the newsletter to reach the community that's going to need to understand how these services are changing and how does this affect my loved ones, my friends, my family, et cetera, is really important.
Yeah, absolutely. The whole thing, but I come from the ones that are saying to me, where's that money? And then you're probably, being as you're with NAMI, you're looking at it from a different perspective, but they do join together.
They do. I mean, they say both.
Yeah.
How does this gonna affect
And
me and my
that's
loved
why-
one, and are they utilizing the money in the way we really
It was
need it to be
intended.
utilized?
So then the other question is, we're talking about a quarterly newsletter. Do you have a suggestion for something that might be, I'm sorry, I don't mean to do that to you.
Asking the public.
That's why I took my hand down.
Sorry, my back
Hand
is
up,
so
hand
quick.
down. So do you, I mean, I'm sorry, I don't know your name.
My name is Wind. My first name's Susan, but I go by Wind.
Oh,
That's
hi,
my
Wind.
middle name.
Okay. So when, do you find something that you use as a go-to for yourself, other than your job? I mean, that's, I'm at a loss. I look at different things that I'm used to and they don't necessarily work. And we're talking about all these different things, like I don't know how to use a QR code. And obviously Anthony does, so that's what I'm saying, is there something that,
I think, you know, for me, and I'm pretty, I guess I'm hands-on kind of human. I'm a person who ends up doing things like talking to the peers about how to get the information. So I'll do that, you know, someone says, how do I do it? And I'll do what you did, you know, here's how you make it, here's how you do it. Like, because that's how I have functioned. But it's necessary, like, even going out and having, whether it's a, dog and pony show of talking about it, but just,
whatever terms you
Yeah.
throw.
nobody, you know, we find out after the fact. We don't know when the pub's opening. We find out after we don't show up on time. There's a lot of things that aren't happening because people don't get the information. They don't know the big picture of how things are changing in the community.
Well, my understanding, and this is, you said you're with NAMI.
Mm-hmm.
NAMI's gonna have offices at the new pub.
Mm-hmm.
So maybe there should be some kind of coordination there too.
Yeah, no, I was wondering, to answer your question, you know, I was wondering, does NAMI try to do more around outreach to the community to try to be a good translator? We're a very small group of people, but we've been looking at stepping up. We're moving. What are we gonna do? How are we gonna interface? How can we help this? How can we be a good bridge to the community, a good bridge to the board?
I would love to talk to you for a minute
Yeah, no,
afterwards.
I'd love that.
Cause I have a suggestion for that, but
Great.
anyway. But this is for media out, this is for how to get to the general public,
Right.
so.
I have one more question. Number one, I think maybe it would be good to, if we do a newsletter, NAMI is a very specific organization for
Right.
outreach for our mandate, for what we're looking at. So maybe taking a corner in a newsletter, oftentimes there's like a message from, and having a consistent, each newsletter having a report from NAMI's perspective, which is really the perspective of the end user that we're trying to reach. And so if we have a column that we know each quarter is going to be in the newsletter from NAMI, that might help, number one, in our outreach effects, and it might help also in making kind of a mechanism for creating this newsletter. The other thing that I wanted to mention, because Denise isn't here and I'm gonna speak on her behalf, is that the other component of this, and we have a significant amount, and plus there's more coming in, of developmental disabled and autistic spectrum, that, and it bridges in our
That
school
was our
systems.
point, too.
Tapestry works with a lot of the kids. And I'm just thinking that maybe we should have something, maybe working with our CRC, maybe working with somebody to have a column in there about things that are happening, resources for that community, because I think that there's such a huge gap and there's just not enough information.
There are
coming out.
gaps everywhere, but we gotta remember that ours is behavioral health,
That is behavioral health.
but it's not, ours is for the, what's the term? I always forget.
That is the county's task of specialized mental health.
Right.
This is, I mean, I hear this with homelessness, and you guys are using somebody who is out there and saying that it is all mental health and drug addiction that causes homelessness, and we can't talk about it, and that is what our mandate is. So, yes, this is a component of behavioral health.
It is, but it's,
I don't wanna argue about it, I just wanna
I
put it
know,
in there.
but there's different purviews for the different boards.
It
and
is,
maybe all
there
the
is no
boards need to
board,
get
this is the board that overlooks all of behavioral health for Mendocino County. This is who is Mendocino County's chance to get information as a system, as an overarching system for behavioral health services. And there is nobody else that's using, this is a vacuum. Denise has been on this board for, I don't know how, like 15 years. She sits on the state. This is a community, you know it's a community that we affect, and that is within our community. And more people are coming in because they're bringing in, the wages are low enough here that people are actually housing people in our community now with developmental disabilities that are adults. I mean, this is becoming a larger issue, I believe. And so I think just having, maybe it doesn't have to be every single newsletter, but just having some focus of a column every once in a while or some information getting out there to this community, I think is important.
I think if we have a newsletter and we've got it on Good to Know Mendo, and we've also put it out in the newsletter, if you are having a problem, here's the number.
Yeah.
If you need to talk to somebody, here's
Yeah.
NAMI. You can have that in there, but as far as when I say our purview, we're the Mental Health Advisory Board, and it's substance abuse and acute mental health. And
That's the
My
county's.
husband has worked with parents and friends for years. I understand developmentally disabled. These are people that are part of my, but that's not necessarily your purview, is that?
It is. If you look on the state.
Excuse me a minute, I asked Dr. Miller a question.
We don't, no, Regional Center, oversees Regional Center from that perspective. Do we provide services to some Regional Center clients that have especially mental health diagnosis? Yes. But as a voice, Regional Center is who is their voice, and that's where the funding comes for developmental and intellectual disabilities. So Regional Center is their primary resource, but our providers do provide services.
For Alex Robar?
No,
No,
it's
it's
Redwood Coast Regional Center.
Redwood Coast, okay.
Yeah, but our providers do provide services to individuals that meet our criteria that can have a dual diagnosis of a regional center
Right.
diagnosis.
Yeah, I'm sure there's dual diagnosis.
Right.
So, I mean, there's so much.
Yeah, I'm even gonna throw in one last thing, which was, because why not? We're having a good time here.
It's all gotta be talked about.
Yeah, as far as also getting more information to youth, we have, in Fort Bragg, a school resource officer. And so I'm wondering if, Ukiah and
Kinda.
Willits do share the same thing?
Kaya and Willits
So-
have separate ones.
I
The
think-
small districts don't have school resource
Okay.
officers. It's
That-
the 3 larger districts that do.
So we'd have that set up with the officer and the
So
counselors at the
Point
other
Arena then
schools.
doesn't have
I
any?
don't think they have SROs, no.
As far as
I mean,
information that
Mhm.
is provided by
Absolutely.
the county, I think that would be, I think a lot of the people.
So,
Do they?
if we did a newsletter or outreach, we should include them.
Yes. I think that would be something where
Yeah.
it would be more tools under their belt for them to be able to get to
to be aware,
students.
yeah, exactly.
Would it be worth it? I mean, we've got all these different boards, maybe overreaching here. We have all these different boards and different people that have purviews that are similar but different, to have like a joint meeting at some point.
Mhm.
I don't know that you could do them all together, that would probably be.
That would be good.
How would it work running a meeting considering Joe, for example, sits on 2 boards? Which
Right,
board
you
would-
have different chairs that would be chairing, so it's hard, I think it'd be hard to do more than 2 boards together. Because you have 2 chairs, and then you start adding, and you start having. Right.
But we definitely could make it so it'd almost be like,
Cotton Auditorium.
well, I'd almost think like a spider web. You know, you have a couple strands that fit together, and so it builds some more cross communication between the different boards, so that necessarily we're not like each rebuilding the wheel for each
Right.
group every single time. We might find areas where we have, a collective like goal that we're trying to reach, and that we could help each other out with it.
My question is more like the Brown Act, like what capacity would Joe be talking in if she has 2 boards that she sits on? Is she
Yeah.
speaking for us or is she speaking for us?
It's true.
Well, that's gonna happen.
So it's gonna happen. I think that there's that option, and I also think you guys have the option to consider, really working on delegating people to attend different board meetings.
Mhm.
And being able to speak and bring stuff back, right? And that might be easier to do. I still think a joint meeting with Measure B is a good idea.
Yeah.
Absolutely.
But, how big do you get? Do you do several joint board meetings, or do you start looking at, hey, we really wanna hear what's happening at this meeting, or wanna make sure that we're connected, they have our resources, they know what we do. Do you start appointing people to?
Yeah, designated representative.
Yeah, who wants to attend this board meeting?
And bring the
And
information
bring the
back.
information back, and bring information to them.
Right. And that's the big thing is, when you are designated, you bring to, if we're asking somebody to be the designated person, giving them that information, and then they give the information, they don't give more, they're a sponge for bringing back to the board they're coming from. mean, that's,
This board used to do that, it's been several years since,
I don't remember.
yeah.
Yeah.
The board used to do that, it's been several, Denise would remember, but, it's been several years, so there were certain things that different board members like, and even in some of the county committees, there was always a board member that was appointed to attend the, MHSA, quality assurance meeting, and that person went to that and would bring back that information. And so it was between some of the internal meetings, someone would be assigned as designated, kind of like Denise is for CIP, right? You kind of have that, but then there were some that would sit on would attend other board meetings and bring information back.
That was a while ago.
What?
I'm just saying, I think it's a great idea. But that would go, but that doesn't go, we've gone again off into the weeds.
Sorry.
No, no, don't be sorry. This is pretty much an open discussion, but, because we're trying to get the word out.
Yeah.
And so any ideas might foster other ideas. So, that's why I asked if anybody in the room had any ideas as well. So, we're pretty much all talking about a newsletter. We talked about the QR codes and having that, getting a QR code for Good to Know Mendo. And would we be able to put a QR code on our page of the county website?
Yeah, I think we probably can. I need to check. I haven't checked ADA for QR codes, so I have to figure out.
Online, you typically don't use QR codes because you just go there and you click it. So QR code's more for physical papers and
Oh, okay.
documentation.
Yeah.
So you scan it, it'll take you directly to the website instead of having to type the URL in.
Okay,
So like if there's something in the
Like I
main
said,
county building
I
that
have no
describes
clue,
what
so-
this board is, the thinking would be, or at least my thinking would be, add a QR code to some of those,
You
some
could
of
do it
those
to your
tangibles.
advertisements, or you
Yeah.
could do it to on your agendas.
we've also
On the
got
agendas,
the,
yes.
Yeah. And thanks for that idea, because the county has, its meetings televised on YouTube and a TV in the hallways. And maybe Rosanna and, the team could work on some specific infographics that then the IT team can incorporate into that. So for instance, on the Board of Supervisors meetings, before the meetings start, it plays this, this slide about how to engage with the board. So if the slide said, this is how you find out about behavioral health advisory
that
board
would be
meetings.
great.
This is how you find out about Measure B meetings, and then it had a QR code that you could take a picture, and it would take you to the website, like, here's where the information about Measure B is, and that resource is
Who does
in
that,
existence, so.
So as
Who does
people
that?
are
Yeah,
filing
we
in
don't
to
have-
attend the meeting,
And it would be on the
and it would be
YouTube,
on the YouTube channel too, okay.
Right.
Yeah, that's a great idea.
it's our IT team that.
A free, opportunity for advertisement for,
kidding.
Yeah.
specifically for meetings to the link. Where
Active
the-
audience.
all of the documentation, and just, this is my opinion, all of the documentation about the
That's right,
budget
yeah.
exists. It's just that people don't know where to find it. And so it's less about,
Transparency.
whether or not that it exists, it's just that in general, people don't know where to figure this stuff out.
Right, and then sometimes you get the people that they want it, and then they look at it, and it's overwhelming, and they don't know how to read it. So then that gets frustrating, and that comes back as frustration too.
So is
Can't
that
control it
something?
all.
Nope.
So
No.
the IT team would be the ones to develop that.
No, we'd have to develop and then send it to them, they would add it.
Okay.
So what do we have to do that? That seems to be the low hanging fruit.
Seems, yeah, it seems like it's,
That's,
that could just be something that we can do
Well,
without
as long as
involvement.
we know what page we're sending them to learn about being on the advisory board, for example, we're on trading.
well,
Is-
wouldn't it be good to know Mendo?
As long as we are adding information, if we're gonna add information on there, we can, yes.
So right now, Good to Know Mendo, it exists as a resource website
Right.
for people that are in the public. It's not
Right.
about budgets and meetings
So they
and
can-
those kinds of things. I feel like Good to Know Mendo, to me, as looking at all of these websites regularly, feels like a place where families, and parents or whoever needs the resources can go for that. And I think that separately, the links and information to the county website that exists now with the agendas, I think that that could all be kept separate and not merge the two.
Is Good to Know Mendo active and up and running it already?
Yeah.
Yeah.
So I don't know if the county has it blocked or whatnot, but every time I go to this website, it can air.
It's only for you.
Only for me?
Yeah,
I
good to
told
know.
them,
that-
because I
You
don't,
can't
I
access
told, I
You
told
got
Dustin,
on?
don't let Anthony in.
I don't.
Good.
See, I told you, Jen got on,
So,
Mo's on,
so
it's just
what's
you.
what would
KNOW. Are you spelling it?
Yeah. I know how to spell.
No.
So my question to you is, if we put one of those up, you're not saying go to Good to Know Mendo, you're saying to,
I mean,
send
well,
them,
what
well,
about-
it could go to the,
I
go ahead, never mind. I'll
So we did some work, I can't remember when we met at the back of Harvest Market and did some work on strategic planning and came with like mission, vision statement. Where does that exist? Cause maybe that, the QR
That was on
code
the county website.
could take us, could take the person to that kind of talks about what the purpose of the Behavioral Health Advisory Board is, and then if it's
take
not
it to our
already there.
page.
Yeah, and then if it's not already there, there can be a link from there to resources in the community which would lead you to Good to Know Mendo.
Right, it would be a step-down process.
It would be another,
Because,
yeah.
because you just pulled up the, is that Good to
This
Know
is our,
Mendo?
no,
That's the
this is the
county
county
website.
website for the
Right.
If the point is to make the public aware that this board even exists and what it does,
Or is there too many
then I'm
eyes on it?
thinking that the QR code, wherever we post
It's
it,
not that much.
should take it,
Although that would be
the
very nice.
public to
Yeah.
an informational page that talks about what the work of the Behavioral Health Advisory Board is.
Something's wrong.
And then
Yeah.
from there, the public should be able to access resources available. Yeah.
Okay, so,
That's my thought.
so what you're saying is to make this a little more simple than it is.
I haven't looked at
So,
it.
no,
That's not,
Website.
that, what is this?
this
It's
is
a
just
county
county
website.
website and has.
Oh, I went back to
the
the county Wi-Fi. Are you on the public Wi-Fi or are you on
I'm
the?
on the,
And then
I don't
you
know.
click over here.
I'm on the public Wi-Fi. As soon as I went back on my phone, it got the same.
And has this been
And the other.
updated since we did the
Could be
work
that, 'cause I'm
on
on-
the,
I'm on both. I can
with the
access
strategic
both
plan with
Wi-Fi.
our mission and
Let's just
vision?
back to my regular, let's see if I go back.
This is Good to Know Mendo. This is behavioral health
So
website.
it's the county's,
So
What?
Good to Know Mendo
county's
is
blocking it
right here.
on the,
I'm
Yes,
sorry, I
that
don't
one.
want to know your shoulder.
But this is your boarding committees. This is your boarding committees.
Very
Your
interesting.
boarding committees.
let me switch to my hotspot.
And then it takes you down to.
What Gina's what her suggestion is to take it to whatever that,
This page,
Yeah.
it would be this page.
right. And then they could drill down from there.
Yeah, but I think we should,
We're not
Zhuzh it
denying
up a
anybody a
little bit.
chance to be able to speak, right?
What?
Or just, if we're taking too long with this, I just wanna make sure that nobody is being denied a chance to be able to speak.
No, that's why I asked.
Okay.
So, Gina, what would you wanna make it more snazzy?
well, I think
Remember,
that
we're limited to
to what the county, well then maybe,
colors and everything, we're limited to certain
Right.
things within the county structure. Now, we are updating.
well, I'm just,
That's my understanding right now.
Yeah, nothing's been updated since, everything is August and July.
Remember Dustin?
Until Dustin came.
He's back.
Poor Dustin. He's
Dustin
gonna have so
is
much to
back.
do.
Yes, Dustin is
But this
back.
is like a good, so I think that,
look like Dustin.
I would just say that I think that all the resources.
People would disagree with you on that.
Yeah, he gets called Dustin a lot, believe it or not.
Might exist, but how do people be able to look this up and understand it? And of
Yeah.
course, we want it updated before we're shouting from the mountaintops.
right.
Yeah.
And does Measure
Stopping us
B
from,
have,
like,
Measure B
Anthony
has
putting
its own
together
page also.
a WordPress
Yeah.
website for us that's Behavioral Health Advisory Board, that we control the content and put together something. You know, other behavioral health advisory boards do have their own website, that's not on the county website.
But that costs money, does that?
It can cost money, and then you would have to still make sure whoever updates it still makes it ADA compliant. You guys have to make sure you stay ADA compliant.
And then don't think I would have time to build
Yeah,
it
we're not
myself,
trying to
but I
make
know
Anthony
there
do,
are local companies that do it. 'Cause
Yeah, we could.
that company on State Street, I know that they build websites, so.
Yeah, there's different places, but again, it would have to be within our budget, and then it would still have to be ADA compliant.
Well, we build a simple landing page, it's like a blog, it'd be like a blog, so it wouldn't be anything insane, it would probably cost a few $100s.
And then the nice part about that too is that with that simplicity, the compliance is gonna be a lot simpler as well.
Okay, see, this is purview, stuff I don't know anything about. I paid for a website.
But one of you would have to upkeep it.
Yeah.
So that has to become a responsibility of this board and not county staff.
Oh, lovely.
Oh, lovely.
Well, is there anybody who sits on this board that knows how to do that other than Anthony? You know?
Yeah, I'm getting more and more out of date with it every year, so. But we've had the Harvest website for a while, so.
Okay.
I would really just say that the information exists and figuring out a way to point people in that direction would be a more appropriate or just more effective use of time. And, you know, the county is using, Instagram, Facebook pretty regularly, and I think it's very helpful, so maybe part of that can again be pointing people to the county website, like, here, I know they post, the meeting is coming up, so maybe there's like outcomes, like a little blurb or something. And I've been trying to, on my own elected official pages, also share out that information so that people
I've
can
noticed
find
that.
it.
So like piggyback the information onto the county?
Instead of reposting it, and that just causes double work, one person posts it here and somebody posts it here.
Yeah, just everybody share the
If
same
you share it, and then you
information.
have one center hub, so if there is a change or revision ever made, you don't have to go and revise it on 15 websites. One place is revised, and the links still send you there.
So if you just provide the content, then we could figure out where.
Okay, so we know, we're looking at the quarterly newsletter, we seem to all agree on that.
And we like the idea of utilizing the QR code and the opportunity to advertise for that at the county supervisor's meetings.
Yeah, that was
Right.
a great idea.
It's just where that QR code takes you to is that we still need to work out, and what's the content.
Well, for right now, a QR code looks like we can make that in 2 seconds.
Yeah, that's
And
not the, that's
I
the
would-
challenge.
I would link it to the behavioral health page that exists right now, because that would just,
Then it's,
Yes.
at least that's a start.
yeah.
And then we could make it a goal to
Have
The
that.
QR code and the
Update
hyperlink
that.
will do it.
Okay. I think we made progress.
Yeah,
Yeah.
they're really, I mean.
And then I
Can't
think,
trust the process.
and I think a joint meeting with Measure B would be helpful
Yeah.
down the road also. Especially once the puff opens. I know we're gonna have an open house, but I think there should be, when we got the bid through for the lodging and stuff, for lodging for the county, we had a huge to-do at one of the wineries. And the supervisor showed up, everything. And I think when the puff opens up, we should be looking at doing,
We won't be going to wineries.
no, I don't need to go to a winery, but I'm just saying to do something.
We are, we're actually planning to have two kind of grand openings. One, will be for everybody, but, the second one will be for those people that live in that community to come tour the facility and really get to learn what it will be in that facility and what to expect. Cause there's still that little bit of like, I'm gonna have this facility in my neighborhood, what does this
Yeah.
mean, how does it impact us? Which is why one of the reasons I really advocated to turn the building and have the entrance off of State Street and not Whitmore was to reduce people driving down the lane and impacting that community more. And so we will have a grand opening in the sense it's just for that community so that they can ask questions of us and the provider And then we'll have a grand opening for everybody, like we always do. We'll make a big grand opening and invite everybody.
And I
It's
think,
looking really nice. I just drove by it the other day.
Yeah, it is looking very
Isn't that
nice.
amazing?
It's looking really nice.
yeah.
I know when I used to work there, I thought it was already nice, and then the roof collapsed and nothing was working.
Oh, you didn't like working
And the
with a bunch of
toilet,
bees?
and all the toilets, and yeah. Yeah, there was a lot of bees in the fire closet.
Oh,
When we went through it, I couldn't believe the dead bees on the ground. It was amazing.
That's after someone taken the hive away, so it's crazy.
Yeah.
A quick question I have on the Good to Know Mendo and everything that we are using for outreach. Do we have any analytical data coming back on if it's actually being used or not, or if we're just putting county staff to do all this work that nobody's looking at?
Yeah, Rosanna can look and see, we do track like how many people have looked, how many new people have joined and started looking at stuff, and Dustin can track the Good to Know Mendo site. Good to Know Mendo, we haven't made it as public as we want it because I feel like I talk about it a lot, but there's so much more we want to build it out. And it's more like, we really want it to be a resource site. But yeah, we can tell from how many people have visited and all of that.
We should definitely go stats.
Yeah.
Okay. So, do we feel like we've kind of got a direction and we can go from here?
Discuss
Yeah.
it with
yeah.
Measure B and see if they want to do this.
Newsletter.
Yeah. Okay, so that's what I'm being charged with the next Measure B meeting?
Yes.
Well, we should add them to the agenda from you.
Right.
Yeah.
We haven't done do we have the agenda?
No.
No, we haven't done that yet.
I think the next meeting is February, right?
Yeah. So we would be having an agenda meeting. Okay, so Measure B, we want to talk to them about the joint meeting? Do we want to talk to them about the newsletter also?
Yeah, I think
Yeah.
that's
We
okay.
should float the idea.
And the QR code? Anything else from Measure B? All right. Well, that takes care of sliding into board and committee reports. That's what I was going to ask about this time. And, Janine already covered the RFP, and that's what I've got. Lo, do you have anything?
You'll notice that I'm here.
We
And Bernie
weren't
as
sure.
well, so we'll be appointed for the next year until the following year. There are 2 seats that are up for re-election, the 3rd and the 5th. So who knows what'll happen next year, but I'm here for another year.
So, John has decided he's not running again. Okay. Has Ted?
Yeah, as far as I know, Ted is.
Okay. I haven't heard. Okay. Jennifer, you have anything?
No, I don't.
Okay. And Martin's not here. So we'll push this until next
Well, I
meeting.
think we can have the conversation, I think the question is, with Jeff, getting off, do we want to do as we've done with everyone, order a plaque and do that acknowledgement? That's what you guys have been doing.
Right.
So I think it's,
When
I
Jeff,
mean, if we do it for one, we should do it for.
yeah. And when Jeff was here, he definitely contributed. He just wasn't here as much as,
Well, he served since 2021,
yeah,
right?
yeah,
So,
okay.
as long as you guys vote that that's what you want, because because it's spending funds, then we will go ahead and get a trophy ordered, and then we can, invite him to one of the next meetings, so you guys can present it to him.
Yeah,
A plaque.
yeah, just a plaque.
I was thinking, I had a I immediately got a visual. Giving him a trophy.
Just a
It's sweet flyers.
Yeah.
behavioral health, so
I
be
can't wait till I get
brain
up to
is
work
on
tonight.
top.
Okay, so,
That might be
do I
interesting,
hear a
Tim.
motion to do that for Jeff?
I make a motion to get Jeff a trophy.
I'll second it.
All right, All in favor, we'll do this by hand again. All right.
Everybody.
Does Goody get a vote? All righty. We should make Goody our mascot,
board
our
mascot.
official mascot.
So cute.
Yeah, he's doing so much better. Okay, all righty. Any member comments?
Thought it was a very productive meeting.
Yeah,
Yay,
thank you for facilitating, Jeff.
you know, that's what I'm supposed to do. All righty, so no more member comments. So do I hear,
Motion to adjourn.
You do hear a motion to adjourn.
I'll second.
all right.
We all are in favor.
We are.
All in favor?
Early.
There's no
Well,
second.
theoretically, when somebody makes the motion, then we shouldn't even need a second. It's
Yeah.
like, we're out of here. All right, thank you guys all.